Caregiver Burden, Lansdowne Caregivers of Dementia Diagnosed Consumers by Emily Weaver. The borough of Lansdowne is located 6 miles southwest of Philadelphia, Pennsylvania. Lansdowne is part of the greater Delaware County area. The population of the borough is 11,044 people. I've chosen to focus on primary caregivers of clients with dementia in Lansdowne, PA. During my clinical rotation at the Delaware County Office of Aging and current place of employment, Lankenau Hospital, I've encountered many adult caregivers of clients with dementia still living at home. In Lansdowne, there are 4,061 people 65 years and older. Mainline Health estimates that more than 30% of adults care for an older adult with a long-term disability or illness. Caregivers are at risk for numerous physical effects of caregiver burden. These effects are depression, anxiety, high blood pressure, higher noradrenaline levels, lower cell-mediated immunity, and 46% more visits to the doctor. Caregivers are also at risk for feeling isolated and with limited social support. Financial stress is experienced from direct costs of care and loss of income. About 50% of caregivers decrease their work hours and 18% quit their jobs. The physical, emotional, and financial toll taken on primary caregivers is now diagnosed as caregiver burden. As the life expectancy of the population continues to increase, more and more people seek to remain within their homes as long as possible. Alzheimer's disease is the most common type of dementia and fourth leading cause of death for Americans 65 years and older. Caregiver burden has become a major issue for those caring for patients with dementia. An estimated 70% of Alzheimer's patients live at home, where approximately 75% of care is provided by family members and/or significant others. The amount of time that primary caregivers spend providing informal care to their loved ones with dementia ranges from 69 to 117 hours per week. Caregivers report lower self-rated health scores, display few health-promoting behaviors, high morbidity and mortality rates, and sleep problems. If left untreated and ignored, caregiver burden may unfortunately lead to neglect and abuse of the care recipient. Studies have shown that high level of burden may be responsible for the exacerbation of cognitive, functional, and neuropsychiatric problems of the care recipient. Burden is among the strongest predictors of institutionalization. Caregiver burden affects any family member or significant other who is a primary caregiver for a loved one with dementia. Caregivers experience stress, depression, substance abuse, loss of sleep, health and mental health problems, and isolation. Caregiver decline may contribute to patient decline and increase the likelihood and speed of patient institutionalization. Young caregivers often assume the dual role as caregivers for their children and elderly parents. Alzheimer's disease is the most common type of dementia in the U.S. Care for persons with Alzheimer's disease in the U.S. costs about $100 billion annually. By 2050, the projected annual cost of care is $300 billion. Caregivers suffer financial stress from direct and indirect costs. About 50% of caregivers decrease their work hours and 18% quit their jobs. In 1990, Pennsylvania passed the Family Caregiver Support Act. This act provides eligible family members financial support and services in caring for an older relative. Caregivers are granted the following: $200 per month reimbursement for expenses in purchasing caregiving services, supplies, and goods. A one-time $2,000 grant for home modifications and assistive devices. Families with household incomes at or below 200% of the poverty level are eligible for full reimbursement, while those above 200% or below 380% of the poverty level are eligible for reimbursement on a sliding scale. Representatives are currently pushing for House Bill 245, which would expand program eligibility and increase reimbursement and grant limits by allowing non-related caregivers as well as those who do not reside with the care recipient to take advantage of the state program. Monthly reimbursements would increase from $200 to $500, and home modification would increase to $6,000. The rate adjustment would be the first of its kind since 1990. As a primary intervention, increasing awareness of programs available to caregivers and the community is important. The government must try to pass legislation that could help with financial and emotional burden of caring for loved ones in the home. As a secondary intervention, the patient-doctor relationship must now expand from caregiver to patient to doctor, otherwise known as the healthcare triad. Caregivers bringing loved ones to doctor's appointments should be screened routinely for their physical, emotional, and mental well-being. The American Medical Association's Caregiver a Self-Assessment Questionnaire can be used to assess for caregiver burden. For those already suffering from caregiver burden, referrals to support groups, counseling, and available in-home assistance can be made. If needed, antidepressants and anti-anxiety medications should be prescribed. Assessment of the care recipient should be continually made. Signs of neglect and abuse should be reported properly to the authorities. Studies have shown that a high level of burden may be responsible for the exacerbation of cognitive, functional, and neuropsychiatric problems in the care recipient. As part of Delaware County, the Lansdowne Borough may access the services provided by Delaware County's local government. COSA provides services to caregivers of dementia in the community with their Caregiver Support Program. The program helps the caregiver find in-home services to assist in caring for their elderly relative. To qualify, the family must live in Delaware County and be financially eligible. The elderly relative must be at least 60 years of age or have Alzheimer's disease or dementia and need help with bathing, dressing, and supervision. The program helps the caregiver purchase services such as companions, home health aides, adult daycare, and other supplies. Program staff can also help caregivers by listening and talking through problems. At the caregiver's request, a care manager would visit with them at home and introduce them to others who are caring for their relative. Two of Healthy People 2020 goals are aimed towards caregivers. Goal number 1 is to reduce the proportion of unpaid caregivers of older adults who report an unmet need for caregiver support services. Healthy People 2020 seeks to clarify the role of the caregiver and then aim to define the support services that are available to caregivers. Goal number 2 is to reduce in proportion of adults 65 years and older with long-term care needs who do not have access to the continuum of long-term care services. Patients living in-home with dementia have limited long-term care services. Medicare pays only homebound Medicare beneficiaries for short-term or acute medical conditions. Lansdowne residents who are able to travel have access to the Senior Center in Darby, PA, 2 miles away from the borough. Transportation is provided by the community transit for 50 cents per trip, and meals are provided for free or a suggested donation of $2. Caregivers in Lansdowne also have access to services provided by Delaware County Services for the Aging. Case managers are assigned to the family to help in connecting the caregivers with services such as counseling, housekeeping assistance, installation of safety devices in the home, and emergency response systems. REACH sought out to test the effects of a structured, multi-component intervention on quality of life and clinical depression in caregivers. They acknowledged 2 facts. First, that spousal caregivers made more emergency department visits and were more likely to seek treatment for anxiety, falls, rheumatological disease, and diabetes than comparison spouses. Secondly, having a positive view of one's health is highly associated with engaging in healthful behaviors, quicker recovery from illness, promotion of physical and emotional well-being, and greater longevity. REACH believes it is necessary for caregivers to attend to their own healthcare needs and engage in health-promoting behaviors. These behaviors may serve as protection from negative outcomes of caregiving. Participants in the study were primary caregivers of patients diagnosed with dementia. Over a 6-month period, interventions focusing on providing caregivers with education, skills to manage troublesome care recipient behaviors, social support, cognitive strategies for reframing negative emotional responses, and strategies for enhancing health behaviors and managing stress were delivered by certified interventionists. Participants in the study used research notebooks with educational materials, video-enabled telephones for group conference calls, and actively practiced role-playing techniques to identify and solve problems. Health passports were handed out to caregivers that provided reminder information of health maintenance activities and a tool to record health information and appointments for both themselves and the care recipients. Training was provided to manage burden of care, emotional well-being and support, and social support were given through breathing exercises, listening to music, stretching exercises, and mood management techniques. A telephone support group was formed to provide sessions for fellow caregivers to interact and express their feelings and concerns. Using scales on depression, caregiver burden, Using various scales on depression, caregiver burden, self-care, social support, and problem behaviors, researchers rated participants prior to these interventions and afterwards. Researchers found that the rate of clinical depression among caregivers in the intervention group was statistically significantly lower than those who did not receive the interventions. Caregivers in the intervention group reported feeling more confident in dealing with the care recipient, made life easier for them, improved their ability to care for the care recipient, and improved the care recipient's life. REACH also found that their research findings suggested that interventions that use active techniques such as role-playing and interactive practices are more effective at improving outcomes such as depression symptoms compared with more passive methods such as providing information. Collaborators for REACH's programs would be County of Services for the Aging, the Pennsylvania Department of Aging, local hospitals in the Lansdowne area such as Mercy Fitzgerald, Delaware County Memorial Hospital, Riddle Hospital, and Lankenau Hospital. Primary care physicians and case managers in hospitals would be able to help assess caregivers for caregiver burden and refer them to the program. Funding would be from part of Pennsylvania Department of Aging and COSA. Because of the different structured interventions, I would stick to the 6-month period as the research study. Considering the amount of hours caregivers already spend with their caregiver recipients, less than 6 months of education would not be appropriate in attempting to educate the caregivers on skills for their personal, social, and mental health. 2 ways to evaluate the effectiveness of the plan would be a self-reported assessment and physical assessment, including blood pressure, hours of sleep, and blood sugar if diabetic. These assessments would be done both prior and after the interventions. A depression scale would also be used before and after the interventions to see if depression, which existed at time of the program implementation, has increased or decreased after the 6-month period.